Artur, thank you for your perseverance. Thank you for, encourage us to try something new and exciting in this new reality in our community. And I think we can start recapping. It's time to take stock of those 3 days of our conference. I hope that we are leaving you with lots of inspiring messages and information. I hope that we have demonstrated a number of successful cases that may be used to continue with digital journey. The goal is very clear. We are not building it and we are not technology aficionados only because of that, but we have the final user, the patient in mind. We have with us our panelists and moderators. Nearly everyone has come together with us. Some have other obligations. We do understand it in those challenging times. So very briefly, we'll try to take stock of what's happened at the forum. So in other words, your takeaways from this forum. Okay, I'll be changing slides and I'll ask each panelist, 1 minute, a very brief statement, key takeaway from each panel. Well, key themes that we have addressed. Well, first of all, the current crisis has proved that digital health has proved very helpful, or sometimes was indispensable because it was saving human lives. We need to keep in mind that we are going to see a very different world after this crisis. And in order to get there, we need, like we've said, strong leadership which understands the crisis and is able to build a community engagement, confidence, and bring stakeholders together. We need innovative thinking and actions. We've mentioned on embarking on a new development trajectory. Old models are not going back. We are not going to revisit them. We are going to be inspired by something else. These new resources will be data and confidence. Confidence will be essential for the new order. We are convinced that Poland is a part of European order, we are facing European and global challenges. Everything that works worldwide will work in Poland, and that we can contribute and create things that are worldwide heritage. What we need in Poland is institutional governance adequate to new challenges that will help us implement all solutions which are very much needed. Global examples indicate that it's possible, and this is heart-lifting, heartwarming, and inspiring. The question is, are we able to learn our lessons, draw conclusions, and co-create our environment to use this inspiration wisely? And in the wake of pandemic, I want to tell you that those people who are creating the new order are right. So we encourage everyone to take the accountability in times of crisis and get committed to development of the new order, the new world, especially in the area of health. I'll ask moderators. Can we ask moderators to speak up? Okay, we have moderators with us. Maria, Tomasz, Andrzej, Piotr, Marek. And Michał. I would like to ask everyone for a takeaway message, 1 minute. Okay, what is the key takeaway from your panel? I'll be clicking slides, and please make a brief statement. I hope that we can see you instead of me, in the corner. Tomasz. Okay, so in a nutshell, I'd say that key takeaways from our panel were guidelines for development of e-health in Poland, and key findings are listed on the slide. So development of telemedicine standards, that is important. Well, doctors claim, this is what Tomasz Zieliński said, that it's essential to create a cloud-based, ADM-based data repository for small surgeries which are unable to do it on their own. And this ties to other topics addressed during the forum. We need to be able to tap into data we are collating. We need to anonymize data, but there are technical and legislative issues with that in Poland, two very different problems. Development potential is an educated and well-informed patient who uses electronic prescriptions and e-registration for appointments and other electronic solutions. And we also stressed that we need to have e-health strategy designed under the auspices of e-health center. We know that efforts are well underway, and this strategy will show us where we are headed in the nearest future. Okay, so in a nutshell. Well, thank you very much, Tomasz. Okay, so patient experience, a panel moderated by Ms. Libura. Well, our panel, which was very exciting because we have presented very specific cases of diabetic patients in Ireland. We showed how they are co-creating the system. It's not enough to say that the patient comes first. The patient must be able to co-create the healthcare system, because user experience or patient experience will finally determine whether there will be an uptake for these solutions. So that's first thing. Inequalities in health, something that was clearly highlighted. And there are two sides of the coin to digital transformations, because on the one hand, it's fair to say that we need to provide equal access to digital technologies, and that we can't leave behind people who, for very different reasons, are struggling with access or are digitally excluded. But a well-designed transformation may be the key to eradicate inequalities we are currently witnessing. So I think that's the key takeaway.
Bardzo dziękujemy za.
Well, thank you very much for your engagement, and thank you very much for presenting conclusions of this very important panel. The public health session was the next one. You were not the moderator. It was moderated by our colleague from Gdańsk, but would you be so kind and present the conclusions? Yes, indeed. A number of issues was discussed, and it turned out that it is possible to apply the new paradigm, moving from activities focused on treatment towards more preventive, more proactive approach that would enable early detection, early diagnosis, and that is more cost efficient and more effective. There is a multitude of different threats, but I believe that well-organized, sensible work can help us overcome these barriers. And let me just add that there were some aspects pertaining to confidence in the system, to system's credibility, and to the data and protection of data. Many different aspects to this panel. The next panel session was the session on telecare, remote care. Piotr Soszyński was the moderator, and Andrzej will have an opportunity to speak in a moment. Piotr, good evening. I'm here, indeed. Yes, we spoke about the telecare, telediagnostic, e-diagnostic during this very interesting panel, also giving us a very interesting perspective from Israel with an organization that provides such care for has been providing such care for quite a long time. So in order to be able to fully diagnose or to have complete information about someone's health status, we would need a physical examination. However, technical developments make it more and more possible to do this remotely, both in case of respiratory tract infections and in chronic disease. We can monitor life functions. Oxygen saturation of blood is an example that is often used during the times of pandemic, but we can also use such devices in the cases of other health problems such as hypertension, diabetes, and others. And we believe that there are large groups of patients that should be monitored on an ongoing basis rather than during visits to physicians, to specialists that take place only once a few months. We discussed a number of examples from different countries, and one thing that is particularly important is the fact that we also had Polish examples of companies that prepare such solutions, and we do hope that soon such remote systems or online systems for diagnostics will be more accessible in Poland. And if it is proven that they are indeed so useful, and they are useful in many centers, they improve the effectiveness of care, the quality of care provided. They are also well received by patients and physicians. So hopefully they will be reimbursed, they will be accessible through the public system. Thank you very much. Piotr, thank you for that panel and for summing up of your session. I think these solutions will stay with us. They are here to stay after the pandemic. And you chaired the panel where Nick Goldman gave his presentation. Could you share your conclusions with us? Maybe we can show you on the big screen. So the inspiration for this discussion panel was the system for validation, evaluation, and certification that has been prepared by the World Organization of General GPs, or family doctors. So the largest system that was evaluated by the use of this application was the Ping and Good Doctor Chinese system, which has 300 million users. And as for the conclusions of our panel, we are not showing the slide. I'm not sure whether we have prepared the slide already. Well, then the first conclusion was a consideration as to whether we should maybe think of introducing the term of virtual care in Poland for wider use. Such system of evaluation uses this definition in the widest possible sense, and in Poland we tend to use more detailed names, so telemedicine separately, patient dedicated portals, self-diagnostic tools. We don't have this comprehensive term, so virtual care could be considered. So this system of evaluation was then used for a brief look at the Polish system. And we concluded that we do not have an integrated system. We use some of the tools and instruments, whereas the Chinese system was assessed by this World Organization of Family Doctors. I should also mention that this system of evaluation, as proposed by Goldman, could be a great support for building new strategies in e-health systems and virtual care systems. It will not replace a strategy, but it can support it. Thank you. Well, thank you very much. This has been a very valuable remark, and we should introduce this virtual care concept to the debate that we have in Poland. And this model of evaluation can contribute to bringing more structure. Michał, you moderated the panel on a more generalized use of medical devices that are becoming more and more accessible in many different ways and contexts, and they change the way we approach their use in the support of our health. Well, this was a very interesting topic. It was more enigmatic, but indeed, we use the term of commoditization of medical devices. But yes, more general use is a good term. So devices that were used by hospitals or surgeries only are now available to consumers, to patients. Many of them are able to use them correctly. However, education is an important aspect. So this more general use of such devices needs to be safe. And in order to achieve this, we need to educate all the stakeholders. We also said that we are waiting for a single system architect. And these are important aspects for the strategy that we are to build in Poland. So we need also the ability to have to react swiftly to changes in technology, because we have to know that this sector is developing in a very dynamic way. So things that were innovative some few months ago sometimes disappear and are replaced with something new. We also proposed two things. Well, first of all, we could use these devices to generate data that would be used by data warehouses for our country, but also our region. And this would build knowledge for the purposes of micro and macro level management. And the second proposal we made, that we should promote dialogue. Polmed Digital is something that we are creating, and we want to bring together organizations that share their experience, and also propose this function of a system architect. Well, thank you very much. One of the new elements of the e-health forum, and I believe that it will be growing in importance for all the stakeholders. Another important aspect that we left for the end of our discussion, so last but not least, mental health and the support of mental health. It is really critical, in particular now during the pandemic crisis. Piotr, would you be so kind as to sum up the mental health panel. Well, thank you very much. I had the pleasure of being the moderator for such an interesting discussion. Mental health is gaining importance in the global sense, and as for the parting message, well, mental health you for. This is something we need to always keep in mind. We all need to take care of our mental health, not only those persons who suffer from mental problems. Our mental health is part of our comfort. It generates problems in everyone's lives. So there are so many good practices available, but we're not really able to tap into them. However, we all believe that, and all the stakeholders represented in the panel agreed, the time has come to reshape the system for mental health support from the kindergarten through all the stages of education and all the way down to the support for elderly persons. We need tools that are validated, secure, and simple to use. And we need to use them in the right way. So this would be the message which introduces a new aspect into the reform of the Polish healthcare system. Well, thank you very much for bringing up this very important topic, and this is something that we will discuss and explore for a long time. Thank you very much. Ladies and gentlemen, the forum is coming to an end. The eHealth Forum 2020 is coming to an end. I would like to thank everyone very much. We had numerous participants, numerous viewers, and this only proves how important e-health is for the health sector in Poland. I would like to thank all our speakers, all our panelists, all the support personnel. I would like to thank our international experts. I would like to thank everyone. I would also like to thank our partners. They are here with us. They have not left us, even though the times are difficult. Also for them, eHealth Forum is a platform for discussion, for introducing new solutions, and for building of a community for cooperation in order to build a better healthcare system. I would like to thank everyone very much and see you during the next eHealth Forum.